Good afternoon, ma'am.
Good afternoon.
Dr. Ayesha Khan is a senior gynecologist and laparoscopic surgeon with over 14 years of clinical experience. She is the founder at NISA Hospital, Tanku. She helps many people through safe surgeries and maternity care. She also teaches students and takes part in medical camps to help the community. Ma'am, myself Durga Bhavani, I am studying extended.
Thank you for your warm introduction. And I thank Little Paradise School, management of Little Paradise School, for inviting me for your first Little Paradise LP talks. Thank you very much.
Ma'am, let us start our podcast by introducing about yourself in your own words.
Yes, sir. So, good evening, good afternoon, everyone. My name is Dr. Ayesha Khan. I'm a gynecologist, obstetrician, and an obstetrician, and I'm the founder of NISA Hospital. I was born and brought up in Guntur, Andhra Pradesh. I did my schooling also in Guntur, in Sri Venkateshwara Balakutir, and I did my +1 and +2 until intermediate. I did in Vikas Junior College. After that, I did my medicine in MBBS in Deccan College of Medical Sciences, Hyderabad, and later I did my masters in gynecology and obstetrics in Alluri Sitaramaraju Academy of Medical Sciences in Eluru. After that, I did my fellowship in laparoscopy in World Laparoscopy Hospital, Delhi. And after that, I did my master's MBA in healthcare in ISB from which is in Hyderabad. So this is my academic journey.
You studied MBBS, then MS in OBG, and later special courses like laparoscopic surgery. Why is continuous learning important in your doctor's career?
Yes. Continuous learning is important not only in doctor's profession, it is important in any profession, whether it is engineering, whether it is architecture. Continuous learning is always very important, especially in medical field where the medicine itself is not static, it evolves. Every year new diseases are discovered, new medicines are discovered, new regulations, new protocols are put into place. So, doctor needs to be updated with this new knowledge. He can't treat patients with outdated knowledge. So, new knowledge, once he has that new knowledge, he can have good treatment to the patient. Patient will recover faster and there will be no medical errors as well. So, continuous learning is very important, not only for doctors, but for any profession in this world.
Thank you, ma'am. At what stage did you decide to become a gynecologist? Is it your childhood dream?
Yes. So that's a good question. Actually, to know what my childhood dream, you should know a bit about my flashback, my history as well. See, I was born and brought up in a Muslim community, in a minority community, where many girls in my community were not allowed to study after 10th class. By 18 years, all my cousins of my age, they used to get married. Becoming a doctor is my father's dream, and he instilled that dream in me. So I thought even doctor is a good profession. Then it became my childhood dream as well. But somehow the profession gave me that freedom and that to escape from marriage. Because I was doing very good in my academics. Because without hard work, you can't do well in your studies, right? So I was studying very hard just to escape from marriage, and so doing medicine was the only option left for me, and that became my childhood dream.
Okay, ma'am. Many students feel scared about long study periods. How did you stay motivated for so many years?
See, studying medicine, becoming a good doctor, you need to spend around 10 to 15 years of your life. And being motivated, keeping yourself motivated for this 10 to 15 years is a very challenging task. So you have to take one step at a time, one goal at a time, 1 year at a time. You can't think about 15 years of your life and become very tense and anxious about it. Take 1 year at a time, reach one goal at a time, make good friendships who are academically very good, who will encourage you to study. Whenever you are sad or whenever you are depressed, talk with them, have some fun, be relaxed, and then get back to your studies again. Third thing, when I was in second year of my MBBS, clinical postings have already started at that time. So direct patient to patient interaction was there. So that was motivating. And finally, my professors, who are like HODs of the department, the way they used to treat patients, the patients used to come and thank them, they used to bless them, they used to respect them. You know, that kind of image, I felt gave me that kind of motivation to continue my hard work and continue my studies for 10 to 15 years. And that image that after 15 years I'll be wearing an apron, I'll be wearing a stethoscope, that image itself motivated me to do my hard work for 10 to 15 years. And finally, this is the stage I am in right now.
That's it. Very great, ma'am. Now we are going to our next segment, skills beyond marks. Apart from good marks, what other qualities are important to become a successful doctor?
Yes. So academics are very important, good marks are very important. Other than that, what do you need? What skills do you need? First and the foremost are communication skills. Whenever a patient comes to you, you have to tell them the problem. You have to explain them the problem. You have to understand. You should treat them with kindness, compassion, and empathy. First of all, you have to understand their problem. So communication skills are very important. Second are listening skills. Patient will come and tell you so much of her problems, the list of problems. You should have lots of patience to sit and listen to those problems. So listening skills are also very important. Third one, whenever there is an emergency, doctors have to work very fast. They won't be having time to think. Decision making and critical thinking. They have to do things very fast, especially in emergencies. The doctors don't have sleep. They have to work under tight schedules, and still they have to be able to decide the life of the patient. So critical thinking, decision making. And fifth one, most importantly, are leadership qualities and teamwork. Leadership qualities, why? Because doctor does not work alone. Doctor should work with the pharmacist, with the nursing staff, with the lab technician. So all these together, they work together for a patient's outcome. So doctors should be able to lead this group, guide this group. So doctors should have even the leadership qualities. And above all, doctors should have basic discipline and time management skills as well. So if you want to become a doctor in future, you have to concentrate on all these skills: communication skills, listening skills, critical thinking, time management, discipline, and leadership qualities.
Okay, ma'am. What skills should students start developing from school if they want to join the medical field?
So from school itself, if you want to join medical field, of course, you have to be good in your academics. Second thing, observation skills are very important in school. Whenever there is a chemistry lab or a physics lab in your school, go and observe what kind of experiments are being done. Observe people around you, talk to people around you, and you should have you should be very good in sports also, because without your fitness levels, you can't without those fitness levels, you can't be able to concentrate. So you have to be good in your sports as well. So from childhood itself, one more thing is you can participate in NGO programs, awareness campaigns from now itself. You can spread good information about how to take care when there is dehydration levels in summer, or how to take care of malaria diseases, how to prevent malaria by eradicating mosquitoes. Or you can go to old age homes and see at the ground level how are they living in old age homes or in orphanages. So from now itself, if you could see and check what is the ground reality happening in the society, it will help you to motivate and work on your skills further.
Good advice, ma'am. How important are discipline and time management in achieving big goals?
Definitely discipline is very important, because for 10 to 15 years, if you want to have a consistency, if you want to do the same thing for 15 years, you need to have discipline for that. And time management is very, very important, because you can't balance. If you want a life to be balanced, you want studies, you want sports, you want vacation, you want to have time with your friends, you want to do research, you want to do anything in your life, just plan it. Time management is very important. It helps you to balance your life.
Okay, ma'am. Now we are going to our next segment, ma'am. New technologies and AI in medicine. You specialized in laparoscopic surgery. How has technology changed in medical treatment today?
Technology has definitely changed the treatment, the way we treat patients nowadays, because of AI, artificial intelligence. The way we diagnose, even X-ray, CT scan, MRIs, everything, they are all given online. Very fast reporting is done. So diagnosis is done very fastly, treatment is done very fastly. Even with online consultations, if the patient is in US and if they want to connect with a doctor in India, it is very easy nowadays. You can just connect with online consultation and take the advice of the doctor. Next, digital health. Everyone is wearing smart watches these days. Watches, they monitor your BP, your heart rate, your sleeping pattern. So somewhere even the digital wearables are also helping us to monitor your health. And laparoscopy is developed, small hole operations where post-op care is recovery is very easy. Within 2 days you will recover from the surgery. And there is laser treatments, there are exoskeletons, even paralyzed human beings, they can walk, wear a skeleton and walk, So the technology has changed so much. Definitely technology will be the future. AI integrated healthcare will be the future of medicine.
Okay, ma'am. Now, with AI and internet, students search health problems online. Is it safe to depend on AI or Google for medicines?
No, definitely not. If you want any kind of information about particular disease or illness, just for sake of information, you can go to Google or ChatGPT or whatever to find some information regarding that disease. But if you want to have a proper treatment, better to go and consult a doctor for it, because in Google, the treatment or the information about that disease is generalized. But when it comes to your health, Google can't customize the treatment plan according to your requirements. For example, if it is for children, the dosage of the drug should be different. You can't give the same dosage as we give to adults. Or if suppose the patient is an old age woman, or if she is a pregnant woman, we can't give all the medications, because few medications are not safe in pregnancy, right? So if you want to know some information about a disease, do check if you want Google or ChatGPT. But if you want a particular treatment, go to a doctor, consult a doctor, and then only take the medicine. Otherwise, you are keeping your health at risk.
Okay, ma'am. Now we are going to our next segment, kids and teens health. Why is it important for children and teenagers to take care of their health from a young age?
From this young age itself, you have to concentrate on your health, because you don't have any option. Your bones will be growing, your muscles will be developing. If you concentrate on good health, good diet, sleep. See, the pillars of health, you have 3 pillars of health: diet, sleep, and exercise. If you concentrate on these 3 things, you have a good brain development, good bone muscle development. You'll become very strong. Once you become strong and once you have a very clear mind, you can achieve whatever you want in your life in future. And second thing, you won't get frequent illnesses. You won't be going to doctor so frequently once you are healthy enough. So indirectly, you will be saving lots of money by not going to the doctor itself. So definitely health is very important, and you should be taking care of it from now itself. Otherwise, in future, once you age, you'll start having diabetes, hypertension, and cardiac problems, and joint problems, and everything. So better to take care of your health from now itself.
Ma'am, how does junk food affect the growth and immunity of students?
Junk food is what? Like, you people eat burgers, pizzas, and everything, right? So what does junk food have? Junk food have high levels of sugar, high levels of salt, high levels of fat, unhealthy fats. It causes food poisoning. So what? And it has very less amount of protein. It has very less vitamins and nutrients. That does not help you to grow your muscles or bones or whatever. So indirectly, your immune system will come down. You'll have frequent illnesses, and in future you will have again diabetes, hypertension, heart problems, and especially in girls, I'm telling you, these junk food, they cause hormonal problems also for you, and it leads to PCOD, obesity. Your menstrual cycle will be disturbed. So better to avoid junk food. having a cheat meal once in a while is okay. Take good food, take lots of fruits and vegetables and home cooked meal, but try to avoid junk food as much as possible.
Ma'am, how does too much mobile and screen time affect physical and mental health?
So this is a very important question. Screen time, using mobile phones, laptops, playing video games, online video games. These things, it causes lots of mental issues, anxiety, irritability, first of all. Second thing, eyesight problems. You will be having some kind of vision problems or, blurring of vision. Third thing, continuously seeing at the phone or sitting in and watching your laptop, it causes your postural problems as well. Like you'll be having back pain, okay, neck pain and back pain and all. The fourth most important is the more time you spend with your phone, the less time you are spending with your family and friends. You will lose that bond between, you lose your relationships with your friends and family, and you will become very sedentary and you won't be able to do your exercises, games or sports. You will give less time to sports, and somehow it will affect, if it will affect your health, it will affect your grades and marks also. So technology should be helpful to a human being. Once technology is not useful according to your needs, then it is dangerous to your health.
Okay, ma'am. What warning signs should students not ignore and must inform parents or to teachers?
Warning signs in regarding of health. See, basic warning signs you all know, right? Like if you have stomach pain, if you have headache, if you have blurring of vision, or if you have cold, cough, and fever, these things are definitely, you go and regarding health issues, go and meet your class teacher or your principal or the rest or your parents. They will take you to a doctor. Especially girls, if you have any menstrual issues, if there is excessive bleeding, if you have pain in your stomach, please go and visit a doctor, get your blood test done. Above all, other than physical abnormalities, if you have any mental issues, like if your friend is very sad, not talking to you for days together, and if your friend is not coming, doesn't want to come to school, please, they need some counseling. Please take them, inform the teacher or inform their parents about your friend's health. He might be suffering mentally because of some pressure, or he might have got some less marks in the exam. Okay, please do take care of each other, look into each other's health. How are they doing? Whether they are happy, they are sad. Even mental health is also very important. And third thing, if someone is bullying you in school, ఎవరైనా టీస్ చేస్తున్నారంటే, if someone is teasing you, definitely go. And if someone is touching you inappropriately, you should definitely go and inform your concerning teachers and parents for that.
Now we are going to our next segment, ma'am. Myths, awareness and social responsibility. Many students feel shy or confused about menstrual cycle. What is the most important thing every girl should know to stay healthy and confident during periods?
See, girls, menstrual cycle is something, it's very normal. It's physiological. It is something that God has given to every female on this earth. And menstrual cycle, having a menstrual cycle every month is mandatory, because the hormones that are released during that menstrual cycle make you into a healthy girl and a healthy woman. So once, it is very normal, every girl should have a regular menstrual cycle. You should not have excessive bleeding, or you should not have very less bleeding also. Please go and consult a doctor if you have any issues with the menstrual cycle. No need to be feeling shy about it. And even boys, you have to be empathetic and considerate towards girls. You should not tease them whenever they feel sick. Don't tease them, just support them during, don't tease them, that's all, I think. So girls, so it is very normal, it is very physiological, no need to be shy about it. You can be very open, you can talk to anyone about this problem. Only how to keep yourself healthy during this time: drink lots of water, eat good iron rich food like carrot, beetroot, eggs, green leafy vegetables, dry fruits, and most importantly, please change your pads every 4th hourly. If that you can do, you will have a very good menstrual health.
Okay, ma'am. As a community member in the district government hospital, you see many people first try home remedies or advice from neighbors instead of visiting a hospital. Why can this be risky?
This is definitely risky. See, following home remedies for any for preventive, ante to prevent the disease from not coming, using home remedies for that is okay. But if you have an active illness, definitely you have to go to a doctor and take medicines for that. Because if you don't take that medicine and right time, you will be delaying the treatment, right? And if you take some kind of home remedy or some medication from an local, by seeing a Google or Chat GPT or buying a medicine from some local pharmacist, the drugs, they become resistant to you. They won't work when they actually have to work. Second thing, dosage will not be sufficient for you. For kids, the dosage is different. For adults, the dosage is different. You might somehow end up giving a higher dosage or a very low dosage that will complicate your treatment. And third thing, sometimes you might get addicted to those kind of drugs without taking doctor's prescription or using home remedies. There is no particular, you should treat the cause, not the symptom. You should find out what is the cause and then go for the treatment.
It's a good suggestion, ma'am. Now we are going to our next segment, ma'am, service and giving back to society. You participated in rural medical camps. Why is serving society important along with earning money?
That is also a very good question. See, earning money and serving society are two different goals. Earning money was very important for me because I want to be financially independent. I don't want to ask money for every small thing. If I want to buy jewelry, if you want to buy a phone or car, I should be financially independent. Money gives all my materialistic needs. But when it comes to my emotional needs, like satisfaction, fulfillment, sense of purposeful living, is giving back to society or doing charity is something that gives me that peaceful sleep and a respectful life. Above all, it increases my reputation in the society, and indirectly it will help to my business only, right? So people will have faith in me, people will trust me, and most importantly, my bond with my community, it becomes stronger by doing charity and social service.
Okay, ma'am. How does helping others make a professional life more meaningful?
Just as I told you, because after one age, after one time in your life, you feel that you have taken enough from the nature. After few years of your life, you start thinking that what am I giving back to the nature, what am I giving back to the society? So what is the use of this much of status, this much of education, this much of respect in the society, when I can't give back at least 1% of it to the people who actually need it, who are in need, right? So for that purpose, to have a meaningful life, I decided to do some kind of charity through NISA Foundation that we have established few years back. And we do free cataract surgeries in our hospital, especially to those people who are not affordable, especially to the parents who are abandoned by kids. They just leave their parents and go to foreign countries to earn money, but they don't take care of their parents. So those kind of parents, once in a while, they leave their parents in old age homes. So every year around 10 old people, senior citizens, we bring them to NISA Hospital, and under the NISA Foundation and under the guidance of Dr. Hussain Ahmed Garu, the eye specialist, we do free cataract surgeries to them. And we also distribute once in a while sanitary pads to low income girls who can't afford sanitary pads also during menstrual cycles. And yeah, these kind of activities we usually do through NISA Foundation, because it is time that you have to give back to the society whenever possible in your own which way. Not necessarily you have to spend lakhs and crores of money in charity. You can do at least 1% of what you earn, that is more than enough.
Thank you, ma'am. Our next segment is advice to students. What subject should students focus on from school if they want to become a doctor, and what advice would you like to give them?
If you want to become doctor, obviously science in subjects are like science, physics, chemistry, okay, botany, zoology. These are subjects which you have to concentrate on. These are academically oriented subjects. But if you want to really become a doctor in future, you have to learn various skills also, like communication skills, observation skills, leadership skills, discipline, time management. All these are also very important along with the academic activities. And you have to work on your physical fitness also. The how you appear, how you take care of your physical health is also very important. Because first of all, a doctor should be happy, so should be healthy and happy for the society and community to be healthy and happy. So doctor can't be in a very sad state and then treat patients, right? You have to be healthy and you have to be healthy and clear with clear mind. Then only you can treat patients happily and give positive results with less medical errors.
Okay, ma'am. Now we are going to our last segment, quick rapid fire questions. You just give one word answers for these questions. Mathematics or biology?
Biology. Actually, mathematics also. I like maths as well.
Okay, ma'am. Hospital rounds or operation theatre?
Operation theatre.
Listening or advising?
Advising.
Reading books or watching movies?
Watching movies.
Walking or exercise?
Exercise. Weight training especially.
Hard work or smart work?
Smart work.
One habit every student should have.
One habit
Every student should have.
every student should have. Habit. Sports. Whether you have less marks, no problem. Even you pass the exam, that is also enough. But sports will keep your mind very active. Sports will teach you how to live a life. When you fail in sports, when you lose, for example, in a competition, when you lose, sports will teach you how to take care of self when you lose the sport as well. And when you win the game, it will teach you how to take care of yourself when you win the game. So sports indirectly teaches you how to lead a life. Okay, so I actually prefer sports.
Okay. Thank you so much, ma'am, for sharing your valuable time and guidance. Your words will surely inspire many students to take health and career seriously. We are grateful to have you with us, ma'am.
Thank you, everyone. Before leaving, I would like to give 2-3 advices to you. Okay. So, మీరు ఫ్యూచర్లో ఏం అవ్వాలనుకున్నా, you should have 3 things in mind. విజన్, మిషన్ అండ్ గోల్. విజన్ అంటే మీరు 15 years తర్వాత ఏం అవ్వాలనుకుంటున్నారు అన్నది మీరు ముందే ఇప్పుడు ప్లాన్ చేసుకోవాలి. తర్వాత మిషన్ అంటే 15 years తర్వాత ఏం అవ్వాలనుకుంటున్నారు, దాన్ని చిన్న చిన్న యాక్షన్ తీసుకోవాలి. ఫర్ ఎగ్జాంపుల్ మీరు డాక్టర్ అవ్వాలనుకుంటున్నారు అంటే ఇప్పటి నుంచే మీరు చదవటం స్టార్ట్ చేయాలి. దాని తర్వాత ఇంటర్మీడియట్ చదవాలి, దాని తర్వాత నీట్ ఎగ్జామ్ రాయాలి. ఇలా చిన్న చిన్న గోల్స్ పెట్టుకొని ఆ గోల్స్ని రీచ్ అవ్వాలి. సో ఈ 3 things మీకు లాంగ్ టర్మ్ గోల్ లేనప్పుడు, మీకు లాంగ్ టర్మ్ విజన్ లేనప్పుడు మీకు షార్ట్ టర్మ్ గోల్స్ అనేవి ఫామ్ అవ్వవు. ఇదొక్కటి మీరు గుర్తుంచుకోవాలి. సెకండ్ థింగ్, మా జనరేషన్లో ఉన్నప్పుడు అవర్ పేరెంట్స్ అండ్ అవర్ టీచర్స్ యూస్ టు టీచర్స్ వర్క్ హార్డ్, కష్టపడండి, వర్కింగ్ హార్డ్ ఈస్ ద ఓన్లీ షార్ట్ కట్ టు సక్సెస్ అని చెప్పేవారు. బట్ మీ జనరేషన్కి వచ్చిన తర్వాత యూ హ్యావ్ టు వర్క్ హార్డ్ యాజ్ వెల్ యాజ్ యూ హ్యావ్ టు వర్క్ స్మార్ట్ ఆల్సో. ఓకే, యూజ్ టెక్నాలజీ. ఎంత ఫాస్ట్గా పని చేయించుకోగలిగితే చేయించుకోండి, బట్ ఇట్ షుడ్ బి ఫాస్టర్ అండ్ ఎఫిషియంట్ ఆల్సో. సో వర్కింగ్ స్మార్ట్ ఈస్ ద న్యూ నార్మ్ nowadays, not just working hard. Working smart is the new norm. Okay, and finally last, instant gratification అంటే ఇన్స్టాగ్రామ్లో ఒక రీల్ పోస్ట్ చేసేయటం, మనకి 1000 views వచ్చినాయా, 100 likes వచ్చినాయా, రాలేదా, ఇన్స్టెంట్ గ్రాటిఫికేషన్ కోసం వెతకొద్దు, ఇన్స్టెంట్ ఎక్నాలెడ్జ్మెంట్ కోసం వెతకొద్దు. సక్సెస్ ఈజ్ అ మ్యారథాన్. ఓకే, ఇట్ ఈస్ నాట్ అ స్ప్రింట్. ఏదో 100 meters రేస్ కాదు, ఇట్ ఈస్ అ రేస్ ఫర్ లైఫ్. సక్సెస్ ఈజ్ అ రేస్ ఫర్ లైఫ్. సో మీరు షార్ట్ టర్మ్ గోల్స్, షార్ట్ టర్మ్ గ్రాటిఫికేషన్, ఎక్నాలెడ్జ్మెంట్ కోసం మాత్రం వెతకొద్దు. యూ నీడ్ టు కీప్ వర్కింగ్ హార్డ్ అండ్ స్మార్ట్ టు రీచ్ యువర్ గోల్స్, టు రీచ్ యువర్ విజన్. Ultimately, one day or the other, you will reach. You will fail, you will get up, you will get to success. That is all there. But You have to work on that continuously. It is not just a short-term activity. So this is what I want to tell you.
Thank you, ma'am.
Thank you very much.